My name's Dr. Carol Antonelli-Greco. I am a family physician here in Wheeling, West Virginia, and I am the founder of the FARMacy West Virginia Prescriptions for Produce program. West Virginia has the worst health statistics in the country. We are the worst as far as diabetes, type 2 diabetes, hypertension, and obesity. At that point, we realized you got to go to the basics. The basics are learning about nutrition and also learning how to cook healthy food, and that's where we came up with this program. So back in 2016, we had a pilot program here at Wheeling Health Right, and that was in collaboration with Grow Ohio Valley, which is our local urban farming group. That prescription that they had for the produce went to the farmer, and the farmer took the produce prescription, and then that exchange happened. And that worked just so well. It was beautiful. We contacted Molly Puffenberger, who is the Marshall County representative, and she was, on the ground with us in 2016. She would provide education during the produce pickup. She would provide, written materials and recipes for the patient. She would talk to the patients and actually do a recipe. She would either do something like salsa or something that was actually doable on the ground during the pickup, and educate people one-on-one as they came through. That was the way the program was designed.
And this week's recipe is stuffed peppers.
It's always really surprising to me what's in the box every week because I never know what I'm getting. I've never had fresh grown carrots, and they're so much better. Oh my gosh, they're just unreal.
Is anybody home?
I'm on 1 second. I'm grabbing your bike.
You got some cool air coming from out that way. Yeah, I'm in stage 4 kidney disease, and I'm on a transplant list at UK and been on it for 4 years now.
They didn't have, his dad would go out and kill a deer, and then when they killed it.
He knew that I had all these health problems, and he told me that it would probably be a good fit for me. Be worth trying anyways.
So different kinds of things with the food labels to be aware of, and different kinds of equivalents that'll go through. And then I put in a meat thermometer, and not a meat thermometer, a fridge thermometer, and one of these. I think this is very, very handy. I love this.
To me too, coming over here every week and getting on them scales and blood pressure, you're kind of held accountable.
You're doing great. I just checked. You started out like 232 and you're down to 213.
238, I think.
Oh, maybe, because it was like a couple weeks in. That's awesome.
I take what's in that box. I'll do it today and separate it and make it last. Put it in every meal for the whole week. It's just unbelievable the results that you get.
Have a good week.
All right.
We'll see you next week.
Hopefully we'll do it next week too.
Yeah, you're killing it, man. He's killing it. How much weight?
It was tough for me to see that CSA version of it because it's really so important that a patient have autonomy in choosing vegetables. We don't want it to look like a handout.
Yeah, when we put the stuff in, I think.
So setting a pharmacy program up to resemble an actual farmer's market where people can come and choose the foods that they want really, gives a couple of things. It provides people with dignity of choice, which of course we all want in our food. We all want to be able to purchase and receive the food that we want to cook, and that we want to enjoy with our families. And it also gets them to engage. With the produce, it gets them. They can pick it up, they can look at it, and they can choose. And if the farmer is present, it gives them a chance to interact with the farmer too. And so it's all part of a system of interaction and support and encouragement for the patients who are enrolled.
But I cook all this stuff.
Do you?
I love making these recipes.
Oh, that's awesome.
I lost like 40 some pounds, and I cut down on my sugar, and they took me off my meds.
Do you feel like this program helps you keep your diabetes under better control?
Mm-hmm.
Yep, we got you.
Nice to meet you, Patricia.
People can control their chronic disease, whether or not it's heart disease, diabetes, whatever it is, by their diet. But they do need to be empowered. And the empowerment in this program is access, but also the education that goes along with that.
So go ahead and put a bite in your mouth. Don't chew it up. We're going to eat very slowly, appreciate our food. Pay attention.
We use a curriculum called Eating Smart, Being Active, and really what that does is that it increases confidence in their own ability to prepare healthy meals for their family. It allows them to see the recipes being prepared using the produce that they received from the pharmacy program, and then allows them to go home and recreate that meal at home. So it's a great way to kind of marry the fresh produce and the support that they're getting from their clinic with some education and some culinary instruction as well, so that they can understand why the fresh produce is really good for them, but also how to prepare it.
So there's a socialization process that happens, and there's a therapy session that happens, and it's wonderful because everyone supports everyone else. Patients have to have a trusting relationship with the people that are providing care for them, and whether it's their diabetic care or whether it's their healthy food care, they have to have a relationship with that person.
You've heard the word. You guys to taste this. Hi, I'm Vicki Fertig with the West Virginia University Extension Service Family Nutrition Program. The fact that the farmers are here on site is invaluable. The information that they can share. I know nutrition and I can teach you what you need to know, but they grow it. They know what kind of soil, how it's been fed, how to utilize it, what recipes. They can provide so much more information than I can.
These are garlic chives.
This is a win-win situation all the way around. From the farmer to the educators to the dietitians to the patients to the physicians and the clinics, the community, it's all interconnected.
We want to be able to help the farmers and the growers in the state of West Virginia scale up so that they can provide the produce that will be needed for this program. And if they can be guaranteed an income with this program, we will see that happen.
Okay, I'm going to show you about rosemary and sage. And let me show you where it is and how to do it. This is a very small scale farm, intensive growing. We have a wide, diverse crop selection. We grow year round. It's all the things that are unheard of because the focus is community. This is every farmer's dream. You've got farmer to consumer week after week after week. So you make a relationship and you are living this with them. And I find myself harvesting based on what they want. It's the personal, you know. They know their farmer, I know who I'm feeding. And we have an S on the end of farms because of our partnering farms. It's a group of farms that I'm just real proud of. They're even smaller than us, a lot of them. And so with using our path to the people, you know, we've got the delivery vehicles, we can pull everybody together and everybody can sell their produce. It's tough to make a dime, you know, as a farmer. But when you come together, united we're strong, you know. I've been paid whether it snows, sleets, hails, rains, or it's blast and sun hot. The sale has been made. It's a guaranteed sale. It's a determined, it's a contract. And you don't come by that very often as a farm. The FARMacy program has made us step out a little out of our own comfort zone. And it's fun, you know.
My goal is to get it in every clinic in the state of West Virginia. It always has been. Obviously, money and funding are the limiting reagent. Being able to incorporate this program into the safety net programs that already exist, you know, those being Medicaid, Medicare, WIC, would be a way to do it. There are funds available in those programs that can be allocated for this program. And that's what our goal is.
Mingo County is a textbook definition of a food desert. I mean, a lot of places, all they have is a dollar store. Like, I mean, we have one grocery store in Mingo County, and it's in Gilbert. And the rest, it's the dollar stores that they have to depend on, or gas stations. I don't know, it's been very eye-opening doing this job. It really is. You really don't know what people deal with until you meet them where they're at, I don't think.
Yeah. 208,
Oh, you've done lost 3 more pounds. 3 or 4, yeah.
He's done so well, he really has. He has been like the star. I never expected anybody to be so receptive about it, but if you have it in your mind that you're wanting to be healthy and you're wanting to make these changes, then it really shows. Every week his blood pressure's better, his kidney function's been better, and man, it's hard to believe that just from a box of food. He's lost 30 pounds in 15 weeks. That's amazing.
Oh yeah, we got tomatoes, peppers.
I delivered Swiss chard
I've never even seen it before. And actually, whenever we eat it, we didn't know what it was. But still, whatever was in this box, we eat,
right.
You know. So we tried it.
He and I were talking last week. He's like, you know, I haven't felt like I've made any huge changes. It's just been a little thing here and a little thing there. And I think really that's what counts. So all those little things come together and make a pretty sustainable lifestyle instead of feeling like, oh, I'm on a diet and I have to cut all this out, cut this out, and I can't eat anything, because that's just setting yourself up for failure pretty much.
Before this program started, we used to spend most of our time down this candy aisle and down the chip aisle. And we spent most of our money down these 2 aisles. And now we rarely go down these aisles since this program has taught us to eat better and buy better. People say it costs more to eat better, but when you minus the money that you spend in just these 2 aisles and take it up front to the fresh aisle, you actually save money. Out of all the cheeses, the Swiss cheese is lower in fat and lower in soda. The frozen one, you get more actually benefits out of it. It's a longer shelf life.
I had never ever, I had an eggplant. And I had to pull up to see what to do with that eggplant. All I'd want to do is lay around on the couch. But now since we've been eating healthier and we've been getting out trying to exercise, walk, and we play cornhole a lot. But just doing that helps us a lot. And you don't really feel like you're on a diet.
Right, the small changes that you make, just like today, it's our grocery shopping that you've seen today is normal for us now. Before, well, we would have, that would have been out of the ordinary for us.
At first I said, that ain't gonna work. We've tried almost every diet coming and going.
Yeah. If people would just give it a try, like I did. I tried for 1 week, and if I didn't like it, I didn't have to do it no more.
Right.
I tried for 1 week, and that was all. And 1 week changed my mind on this program. But I thought, well, what's going to happen in 2 weeks, 3 weeks, 4 weeks? If I keep this up, what's going to happen? And here it is at the end of the program, and I've lost a lot of weight, and all of my blood work come back normal, and that's never happened since I've had these health problems. So this program right here, like I told you earlier, it saved my life.
Food really can be medicine, I think. And instead of just throwing a pill at everything, maybe try this first and see how that goes.
You look at the insert on a package insert on a medication, it always says, use this medication if diet and lifestyle changes have not worked. Well, in our medical society, we don't do that first. We showed that, the hemoglobin A1C levels are down at least a half a point, which, doesn't sound like much, but when you compare that to diabetic drugs and how much they say they're going to lower hemoglobin A1C, it's right up there along with medication. So that plus we lowered the lipid profile, the total cholesterol, by about 8 points. And again, when you think about what we didn't do anything other than put produce in the home, gave it to people that may not have been able to afford it, absolutely could not afford it and didn't have access to it, and then taught them how to use it and taught them why it was important to eat it. So that's all we did.
Samantha Shawley-Brzoska, and I'm in the Office of Health Services Research in the WVU School of Public Health. What we look at is data that's collected at the beginning of the program, at the end of the program, and along the way. So examples of that could be weight, it could be A1C, cholesterol values, and then also a lot of survey data is collected behind the scenes along with attendance. We've actually created a standardized process so that the data can be collected in one system. We have standardized forms across the state that folks use. In the past, it was collected on spreadsheets or paper copies and then translated into an electronic system. This way allows for them to run direct reports and help them to advocate for funding across the state. So when we bring all of those different county level data together, we're able to see a bigger picture and the impact. So this one is a policy brief so that we can meet the partners where they're at in terms of showing the success of the program and where we're going with it. With a lot of work we've done over the years, what we've noticed is, there's really great programs, people are doing really great work, but if you don't have the health outcomes to show for it, we don't really know of its impact. And we're able to see the impact at a population level when this data is collected, and we're able to make things better across the board.